Volunteers are one of Scottsdale Healthcare's greatest assets. For over 50 years, the Scottsdale Healthcare Auxiliary has assisted the patients and medical staff at the hospitals of Scottsdale Healthcare System by donating their time and skills in many areas of the community-focused system. The Auxiliary has grown from 30 members and hundreds of hours in 1961 to over 1,400 volunteers, giving more than 5 million hours today. I have never worked a shift as a Scottsdale Healthcare volunteer when I did not make a difference in someone's day. With the concept and plans for Scottsdale's first hospital not even a few months old, a group of women met in March 1961 to organize the City Hospital of Scottsdale Auxiliary. The initial 30 members quickly grew to over 150 volunteers within a few months, and more continued to join as the hospital was constructed. Mrs. John Witkowski was the organization's first president and welcomed the community to the new hospital when it opened in May 1962. The auxiliary members worked in 11 areas of services, such as the admitting room, information desk, and would perform such tasks as delivering flowers, cards and books, distributing dinner trays, and taking patients to the X-ray facilities. They also assisted the nurses by taking care of routine duties, such as making beds, thus releasing the staff for more clinical care. The auxiliary members volunteered in the pediatric unit, where they assisted nursing staff with the children. In the emergency room, volunteers answered the phone, assisted with the charts, and provided support to the ED nurses. Those who could not volunteer at the hospital were given the opportunity to work at home, such as making handmade gifts for the young patients. The auxiliary members were required to give a minimum of 60 hours a year to maintain their active status. The hospital staff could easily recognize members of the auxiliary group. In October of 1961, the members received new uniforms created by Robert Schmitz, a Scottsdale fashion designer. The colors of white and orchid were chosen. Orchid would be the auxiliary's major theme and color for many years, including the name of the group's newsletter. Today, the auxiliary members can be distinguished by their light blue smocks or shirts, smiling faces, and helping hands. An important function of the auxiliary was raising funds that could be used for the hospital, which had been renamed Scottsdale Baptist Hospital in November 1962. An initial spring fashion show at the Safari Hotel brought in more than 600 guests. In December 1961, the auxiliary held its first Orchid Ball at Mountain Shadows. The funds raised were used to finance the operation of the hospital's library, gift and flower shops, and other services to various departments. One of the first purchases by the auxiliary was an iron lung in 1962 to help with patient care during the nationwide polio epidemic. In 1968, the auxiliary partnered with the Scottsdale Charros to park cars for the Chicago Cubs spring training games. This provided another source of revenue benefiting the hospital located across the street from the ballpark. Other changes occurred in 1971 that impacted the auxiliary. Scottsdale Baptist Hospital became the independent and community-led Scottsdale Memorial Hospital. That same year, Greg Simons, a 17-year-old Scottsdale High School student, started volunteering his services, becoming the first male auxiliary member. It is the tradition of the auxiliary to assist the hospital in serving our community. In 1962, the auxiliary participated in the Sabin Oral Polio Vaccine Clinic. Building on this tradition, the auxiliary's commitment to a healthy Scottsdale community has included past programming such as the Health Adventure in the Park to our recent support of screenings and education for cancer, cardiovascular disease, and health-related concerns. 1983 was also a banner year for both the Scottsdale Healthcare Hospital and the auxiliary. Scottsdale Healthcare opened a second hospital on Shea Boulevard with Nancy Reagan, President Ronald Reagan's wife, as guest of honor at the dedication ceremony. The auxiliary had trained over 250 volunteers to work at the new facility on Shea. Members of the Auxiliary later raised funds for the Virginia G. Piper Cancer Center at Scottsdale Healthcare in 2001. When the hospital system expanded to the Thompson Peak facility, the Auxiliary pledged $1 million in 2006. In recognition of their efforts, the lobby is named for the Auxiliary. The Auxiliary has evolved as a patient and family-centered service group with fundraising limited to gift shop and baseball revenue. Through those funding mechanisms, the Auxiliary has developed a competitive teen summer program for Scottsdale teens and 3 SHC and Charos scholarships to those interested in pursuing a healthcare profession. Additionally, the Auxiliary offers funding to hospital departments to develop new patient-centered initiatives. Activities of the Scottsdale Healthcare Auxiliary have evolved over 50 years, but many roles have stayed the same. The Auxiliary now has an executive director, Felicia Prostrollo, who oversees the Auxiliary and volunteers' roles, training, and programs. Each volunteer or auxiliary member commits to at least 100 hours within a 6-month period. The volunteers continue to assist at the spring baseball games and garner additional funds with sales at the gift shops and baby photography. Auxiliary members continue to support the staff at the information desks, serving as a liaison to family members in waiting rooms and providing support to our patients and their families. They can act as a liaison between patient and hospital, providing resources and assistance when needed. The volunteers today receive almost 3 weeks of training prior to assisting at the hospital. Knitted caps made by Auxiliary members are still given to babies born at the hospital. According to Prostrollo, our volunteers make a difference day in and day out.